Mo Sharpe for the Power of the Patient Project. My guest today is Emma Nolan. Emma Nolan is a recent graduate of Penn State University with a BS in Biobehavioral Health and a minor in Rehabilitation and Human Services. That's a mouthful.
Yeah.
She is continuing her education at the Penn State College of Medicine to receive a master's in public health with a focus on health systems, organizations, and policy. Emma has worked for the Pennsylvania Department of Health as a contact tracer, as a student researcher for BBH projects, and for Penn State as a COVID-19 test site volunteer. After completing her MPH degree, Emma plans to pursue a career in health policy, hoping to create policies that will help to combat health disparities and improve access to health care. This summer, she was one of the lead researchers for the MedFocus Research Project. So welcome to the Power of Patient Project, Emma Nolan.
Thank you for having me.
All right. First, tell us about your role of a senior researcher for MedFocus Research. What were some of your responsibilities in this role?
Yeah, so I was on the patient team this summer. So we focused at first on conducting a literature review, and we put together just a comprehensive paper about the social determinants of health, such as like religion, access to transportation, geographic region, and how they can influence the patient experience and influence health outcomes. And then we moved on to developing a survey that included just questions about all of those determinants of health. And we focused on a mental health setting, women's health, and primary care. And then after that survey was completed, we worked on distributing that through various social media platforms. We used LinkedIn and like Facebook. And then another part of the team worked on compiling all of that information and providing providers with ways that they can help like ease that patient provider relationship.
Awesome, awesome. It seems like you had a busy, busy time.
Yeah.
I understand the major focus of your research was on physician burnout and how it affects the attitude of the provider. Could you tell us more about what you found in your research?
Yeah, so there was a lot of interesting points that I found while compiling that information on physician burnout. I really wanted to focus on like why this was happening and why there's such an increase in the amount of physicians who are experiencing symptoms of burnout. And I found there's a range of factors that can range from like work-life balance to actual policies that are put into place in the healthcare industry that are just making these physicians feel as though they like have a loss of autonomy. One of the policies that I focused on and I found really interesting was the HITECH Act, and that's the Health Information Technology for Economic and Clinical Health. And it just switched all hospitals to, or a lot of hospitals to electronic health records, and kind of mandated them with financial incentives for like Medicare and Medicaid programs. And it does have a lot of benefits, but it also kind of like streamlines patient efficiency, which does lead to physicians not spending as much time with their patients and having to put everything online, which takes a lot of time, which definitely leads to like that loss of autonomy and feelings of burnout. And then I also touched a little bit about how COVID-19 has impacted physician burnout, and like the physicians were working with people who were very sick, and like a lot of people felt like there was nothing else that they could do for these patients, and they couldn't see their friends and families all the time in the beginning of the pandemic with all that uncertainty with what was going on. So those were a lot of things that lead to those increased feelings of burnout. And then I also kind of touched on things that can help with burnout, both at an individual level and like an organizational level. Physicians themselves can take some like surveys to understand the early symptoms of burnout and kind of take a step back and focus on themselves for a little bit so they don't get fully burnt out. And then at an organizational level, there are some like like charters. There's one that's called the Charter for Physician Wellbeing, and they focus on like establishing a healthy workplace and having support systems in place within the organization to help the physicians.
That brings up an interesting point. I have a follow-up question just to the physician burnout.
Mm-hmm.
Did you see it more with physicians who were newer in their role as to those who had more tenure as a physician?
Yeah, I think that there's probably two aspects to that, because with the like electronic medical records and stuff, I think that people or physicians who were like older and already in the system before all that had a lot of trouble like shifting from the paper records to that, and that could definitely increase burnout. But then at the same time, like the newer physicians who were in here and who had to experience COVID in the first couple of years of their medical profession definitely were in for like a shock of how much it affected them, I think.
Okay, that's really interesting.
Mm-hmm.
And finally, based on what was learned from the study, what are some things that providers can do differently to create a better experience for patients when they visit a healthcare office?
So I think the number one thing is just having that mutual respect between the provider and the patient, understanding the differences, whether it be like your gender or your race, ethnicity, whatever it may be, understanding those differences and answering any and all questions that the patients have when coming into the office, and understanding that it can be a scary experience to go to a healthcare provider in any setting, whether it be like the primary women's health or mental health. It can be very intimidating. And then just having that like open and honest communication and using language that is clear for the patient to understand, and just like reinforcing that the provider is there for the patient with anything that they may need.
Yeah, I think respect that goes a long way, and people will be more patient.
Yes.
Respect. Well, thank you for your time today. That's all the questions I have for you, and thank you for taking time out of your, I know, busy schedule.
You're welcome.
These questions for us.
All right, and thank you for having me.
And I'm Mo Sharpe for the Power of Patient Project, and we will see you later.